St. Joseph's was founded by the Sisters of St. Joseph's in 1869, and they started this community caring for the poor and for orphans. From those humble beginnings, we have grown into a multi-sited organization that provides care, teaching for the next generation, and innovative research for the future. People who have been cared for and who work here have often said that the legacy of the sisters and the compassion and care that they provided is steeped into the walls of the organization. And those who receive care here and work here feel that, and they adopt that as part of the culture of care within our organization. We are guided as an organization by Catholic principles and a healthcare ethics guide based on the Catholic tradition. However, part of that tradition is to welcome people of all faiths and be inclusive in both our work environment and in the care that we provide. And indeed, we have provided prayer rooms so both patients and staff members of varying faiths can express their own faith experience while they are employees or being cared for within the organization. We also think it's very important that care isn't just about the physical. Care in caring for people is about body, mind, and spirit. The whole person is very important in any healing journey. I often hear stories. We've invited the community to tell us their stories about their care, how we have earned complete confidence in the care that we provide to them. And so the stories do come in by letter, they come in through our email, and they help us to know what's very important to patients. There's a patient, he's 92 years old, and as a young child he played the violin, and all through his service years played the violin. By the end of those years he lost his violin. When he became part of the Veterans Care Program, he shared that heart's desire to rekindle playing the violin, and so the staff at Parkwood facilitated getting him a violin, and he's been able to re-engage in something that's very important to him from his past, and he's now playing the violin again. Mount Hope Centre for Long-Term Care, people are adapting to big changes in their life when they come and live with us in that environment, and they're often dealing with significant health issues in many ways. The art therapy program at Mount Hope Centre for Long-Term Care allows people to express themselves in ways that allows them to deal with their emotions and the journey that they're on as far as care and life changes, and that's been very helpful for many people.
Art therapy is designed to help individuals who are in long-term care. Mount Hope created a program to bring about the optimal level of functioning for all of our individuals. And so in the process of developing the program, we have provided an opportunity to establish the individual needs of every individual and to create an intervention which would allow for the best physical and cognitive and emotional functioning of every one of our residents.
Well, one thing is that some parts of my life have become impossible to live, but there are other parts of my life which have become developed simply by being able to come here and discover that, wow, I could really paint. And also it means that you aren't just living your life day after day as they come. You're developing yourself. There's hope. There's a future. It's the beginning of something else. You know, developing another part of myself, which I may never have learned if I hadn't come here.
There's a patient named Kash Hussain. At a young age, he was diagnosed with a disease that impaired his vision and left him feeling very alone in his life journey. He has been supported significantly by the St. Joseph's Ivy Eye Institute that has helped him to deal with the changes in his life and feel more a part of the community again.
You're left stranded. When you get that diagnosis, you have nowhere to turn to. You're all alone. You think you're all alone. And so you reach out. You reach out to your family members, and they are just as lost as you are. They've been a great help. They've assisted me in coping. They've assisted me in learning. St. Joseph's has helped me live fully in the community.
Our mission not only drives how we provide care in a very compassionate way to our patients, it also speaks to how we treat each other in a respectful manner as colleagues and as care providers.
We acknowledge that no workplace can be truly alive until we see the divinity within one another, until we experience behind the breastbone the breath of life, until we insist that our work will not be the humdrum product of a sleeping spirit, but a glorious monument to who we are created to be.
I really have a history with St. Joe's, and I couldn't be in a better place. I just love my volunteering experience there.
Our mission is an integral part of how we plan for the future here at St. Joseph's. We will continue to live our mission, guided by the example of the healing mission of Jesus Christ, and strengthen our roots as a Catholic organization.